ɔbaa ano nso ntumi ngu lifestyle bɛn sɛ pathological causes ne saa nneɛma no nyinaa wakeka no nyinaa nti lifestyle bɛn ɛna wo ɔpɛ sɛ yɛ live a sɛ yɛpɛ sɛ yɛwo a ɛbɛ guarantee yɛn
sorry mema first and I say ma so oba me code di ha me mo fa nche meti for
no ma
oba me start me can say cervical factors can be a critical thing when about so oba cervical audio no on say na maybe o kwa mo tanya infections especially chlamydial infections gonorrhea onya ye na ne sebi because of say ye advert be radios near the obias nedrosa go no obias nedrosa your friend say chlamydia obias ned white bia you go no ni na de now people are treating and taking some means say obi adwuma there but what I'm saying is that onya such infections especially so your about reproductive years bra hospital near show ye because there are important investigations test a bit near ya a bit near me who aboa property air causes infection and yama would bit me a treaty. Now one but now so ano someone betimi anyini akwa wodie nim edidi akwa say with tubes you know. And how do you get these infections? Through promiscuous sexual lifestyles. And I say promiscuous lifestyle, I say you stand a higher risk of getting these infections because they are sexually transmitted infections though. Oh no. It is all your bar also to make you free no man. Two. Enro nonom basa because medical can say enro bu ho no ma intimi ma yenkosu atomu kranya dai enkoye ohunu inti anu nso so o se dai ye careful our side no. 3 smoking alcohol especially smoking for women so smoking so betimi ama o she cigarette ni ade a it can also increase your risk of becoming infertile. What I say, and also no for the sake of education.
Smoking or how?
We can say cigarette smoking.
How does it?
Yeah,
affect
in fact, it's one of the things that can affect because nicotine and as almost smoking. One of the things that can affect almost every single structure in the human body in an adverse way. The smoking is dangerous. It can cause a lot of problems for the human body from utikosi unasi almost like every structure in the body can suffer from the effect of smoking these substances nicotine and as a tobacco and no smoking, to cut a long story short, is also a dangerous thing that can also affect your fertility. And abuse of alcohol, prolonged use and abuse of what? Alcohol, it can also cut down on fertility. In fact, where the kama both a bar any day in bear manina mekama
na abortions and so
mekaba abortions so abortions na yo mu ahodo mienu yo de no ababesne ko spontaneous abortion ni control bia wo so asai na abesne ko na basa ko hospital na de yentwa scan ni hwese de akam no edoso a ye piama na free ho na ye de ama onuru antem se na bia onya infection bi after the abortion and ye wo induced abortion as a termination of pregnancy on the oma or no one in or nim say be on penins and into so be call hospital na bia ye na fa counseling munia fa kwan papa so omo ye free ho ama no ad nepe akoto adura na so bia ma ne dro di ahye na sia na ne baby no onom na afi da be septic as say e baby a di akamu no and so the wobbling you so okay it may be infected na bon na afi they started the konemogenim infection no konemogenim. I say that's what I mean by they become septic, like septic abortion. So when that's when seriously infected, almost hospital. One son say it did konemogen could be a friend septicemia. One, you're careful a bit me a como quick. But I say, and two abortion
septicemia naturally
infection of the blood. Yeah, chin
papa mubu treat what they make say treat their own to me in one word that the explanation
okay so akwai abortion no ka oye wie no efri ho no ɛnyɛ sɛ woyɛ wie a wɔwie kɛkɛ ɔ sɛ ɔma antibiotics ɛbɛbɔ ho ban a wontumi nya infection biara bɛɛsiane so ɔno ana yɛ no adeɛ nti na wonnim sɛ ɛwɔ so yɛ protecting against infection from the abortion no ɛwɔ sɛ yɛma no prophylactic antibiotics anasɛ antibiotics ɛbɛbɔ no nnura bɛbɔ no ho bɛfiri infection ho no woanyɛ bi wamfa na kakra na aka mu deɛ aka no ase no ayɛ infected ɛho ɛka sɛ infected deɛ sɛ wote aseɛ na start porɔ wobɛhu sɛ ɔse nsufin nsu kankan ne mogya so finyɛ den egu me firi mase ba na me ho ayɛ hyehyehye abode bɛte ɛsɛ wɔtwa ahwe ɛhɔ na sɛ infection ɛde kɔ ne mogya mu so ho ɛde kɔ ne mogya na mka sɛ they can go into what we call septic shock ɛna meka sɛ ɛde kɔ ne mogya mu a wɔnya obɛtumi septicemia na wɔ go into septic shock ɛyɛ sɛ ne blood pressure bɛba from ne pulse hyehyehye.
Capital Radio 97.1 FM so na wotie abɔ nonson.
Apart from so saa abortion ya also of course hospital near ma onko no de akɔfa afikyire bi na obi de bibia akɔhye na no de awo na mese mia ye ho bi pen ɛwɔ memodi ba esi yo baabi ɛna mo de nipa ne ba konfo no kye ye operation man no obi ɛso ɔyɛ abortion ma obi o ye chokrodo za wo de aboa wo de nim so there's what called uterine perforation ade ko de wo de aboa wo de nim ma na akɔtwe nipa no nso no nipa no nso wo se akora na black accord na eba but don't realize ma me na a pass out ama sebi agyanan nyina afi na se eba na afi no mo rush ne ba konfa no kye otete ne nso no nyina de na bese meka at that point wa say wo de no oba wo se ya wo de ni free ho ye nyi a obewu ti de na wo se wo ye our send just untimi repair uterus no we uterus ni wia what you say donc we uterus ni wia obetime nyinsa bia mana dabi esi adi konfono eje o engine pa o gini pa nkwa bebre pa doing extremely well because some no ma bia ye hu no de bi no ma bia sisi baby a o rush o ba ho no nti these are all consequences when you wakoye sa abortion ase when you uterine perforation na say ayesa da say ya nyi wa wode na obewu a yebeyi at least otiase na oni ba kra say better nti dem make nya say o sa akoye sa abortion na say wa nye na kwa ampa so no wanko be papa betimi ayama yi a ebetimi ase wa wode na ma afide ye ni choice o say you wa wode na no so betimi say what is obi oni awode nti ntimi ye dey enyinse na wa dey wawo ti no sa no the only thing I want say obepe oba foforo na bia ifa okosua na afa okunu no enkom na de ahia na de akoto sa oba no awodi ma mo na ife surrogacy no
tiremu
surrogate mother say afa oba no okosua eni afa okunu sperm eni ya fertilize wo test tube ye na baby na afa mo no ye de akoto obi awodi ma ma
obi foforo oba foforo
ai that's a surrogate mother na make a surrogate mother no then tin de na de ya okunu sperm no okosua na ba oba foforo na beda na yam owo na e bia ba ba gemo ba
ero so boy say
eni mini ba ne boy these things I spend you can is any boy then papa you can imagine ne boy then so nti ewo insunsanso bebre but until say we be do that stage I say e bia say bi waware o peba no e da bon say sa no ma we ya boboso yi aye no ma tra ya fa ne tra no with serious implications on your brabo as nipa and on us as young kasa so your future with regards to your person nya a man I say enquire away in chain
yo to aswe and say be our lifestyle and out na me dey abortion be shame
and na ti and a mema so the same then na makabia ma mema na ma so ensa bebre smoking I don't say na city
na mema nso ahia adware nso so say ade na hia hitu
oh I mean me can persistent prolonged exposure to heat then am kasa da be dware nso hia kra ho se wade no ebobo na apagya ne ko ana meboa
ai o se so hia Canada ya sane eyenua
ebobo na kama na ha nti on this control no ho dia only problem but you can in a situation where obi baby and nipa ye adwuma no or high temperature prone environment it can affect it and as will be or tenase chair or drive from maybe a cry ibia to Burkina Faso no break straight me the cancer more high temperatures obi or involved in strenuous bike riding, horse riding, those strenuous activities, all of them stand the risk of, raising those.
Obama she no betumi the infertility aba oba no so say be man na de no ekowo ba bia ana no de entimi fa
Debbie adai we nko ade
and then entimi fa
Debbie no, there's no end there sa na design no enti sa na o say so ye na say o ne dia na de ko ba bia o say ko dia inso so boni bia ama eso said de kura ye de mu bebie ama na timi contain
yo make I must say phone line here 0557 52 22 13 0557 52 22 13 wait me send a WhatsApp say want to me entron so I wait me a voice note e de abre we me voice note a mebo na Dr. Ayi Wano that is for WhatsApp messages Maminko papa no osan bi say bi mo say okay role bay and a herbal medicine a play infertility not even just herbal medicine but medicines ankasa enrobi wo ho a onum a ebetumi ama be ma na ye infertile na betumi ama oba na ye infertile and I was one person obebo so na obi akofa
yeah me can say there are some drugs when you take them for instance Bema. There are certain medication because anabolic steroids. Obi also be macho. Into your tablets be ya omo forma nim. Omo nim, omo fa. It me bo muscles near day. Eba akese. But remember say we introduce exogenous steroids into the body. Into you be suppress our body ability to produce the natural one our body nim let me year juma years the way my testis and responding well. I know you will no be a swan casaswa, for instance, and also to me can be bored over Majai, and also to me, Emma spermatogenesis as a key play. You can say, I won't say, send your own common or produce. In Rubu of far a 6-hour process, no coin.
Almost say diabetes a drone.
No.
Na pressure so a drone.
No, but it's a drop about qua meaning say, yes, I know, not say Muji Minugu be a more. A friend cimetidine. And the drug doctor and trauma could tell me to say market so and we can inhibit spermatogenesis. I say, again, you will other drugs I mean me body. So for salax and pneumonia and a work will go through chemotherapy. Also when your cancer be now you treat as one of the side effects of the medications. Some of the youngsters are in only treated cancer, chemotherapy, they do one ma inhibit cell growth. Cells be of course will multiply sperm, and see a bit me inhibited those processes from the ovaries and also in the testes. What I said, and also bit me affected fertility. Also a bit me a pelvic irradiation. Like I say, hospital. Maybe or some form of cancer be on na yase I mean cancer na you can you be a you bet be a shit sa cancer cells no sa e wo say a shit cancer cells no but one hwe yesu sa normal cells na and so where yase e ho na ye ovaries one ya de no e bet me eden ahye no so part of it and I say bet me akoka no and so nya sa in a losing the ability to what to multiply and really do what it's supposed to do the human was saying that's what I say. Coming back to another question earlier, say herbal medicine. What role do herbal medicines have to play when it comes to fertility? I will say this. Yantias say normally fertility bano. Your structural causes and your physiological causes.
Structural causes.
Structure need to say. Once make bubos make can say obu we need tubes. Obu and the tubes na say. Obu na wodi no fibroid kese eden edem obu odi na wodi no fibroid na edem aka ma na eden esi ti the only way obetimi aboa sa nipa no ene si be yi fibroid na through operation na wodi no mo eden etimi eden ada ho na bia nyinsa na etimi eden aba what you say o can say abortion me refi o can imagine you free baby Asherman syndrome obu ho wa ya abortion santi wo kwa ne yadwina wodie ne mu santi nwura na esa na wodie ne mu no yadwia ama na nyina sa aka scar kro crew and the scar no kutwa.
Okay.
And it was even Asherman syndrome. What I say? Such a person, you need special care to be able to. There's a normal bit me ama sani pasano. Aboa eyi sa scan e fro no man no bit me ama den e grow. Me can be see asem so. Obi of fibroid kese obi hia surgery to take out the fibroid. What I say? Obi ebi owo ovarian cyst bi ana cause problems ana bi bi nipa no. There are things we can do, to help the patient. In other words, most of the structural problems, I know man because of say structure no. And who I told you, say bibi say mami fafa na easy for me. Bring your operation. Untimi nkasa o komani pa no sebi herbal medicine. No one mama fibroid na den anane na watimi den enyin. But I've also known, I've read literature, I've read documents, scientific documents. Herbal medicines have been used to improve hormonal function in women, for which reason medicine is insane. And if it's probably a hormonal problem, hormones need be normally to tow ye. And as I say, normally, I don't normally want to use the term hormonal imbalance, but regardless, for the sake of your discussion, if your hormones are imbalanced, I can say herbal medicines are fine. Some of them have fine ability to regulate hormones. You beat me mobano say structure be a fine, na be a pepper. You beat me a boy, I may be a hormones. Na
did the person can say baby drono and to mean correct any structural dysfunction?
Yes, so you have to be careful when you are giving it for structural problems, anatomical challenges.
So to me correct it.
That's why I said structures, and we use some of them will need surgery.
Okay.
What you say? And them kind of structure, anatomical problems. What you say? So we will septate uterus. I wouldn't match it to a drobby and one man open my bend and I'll say operation it me the achemony free ho. Name would that one sent me a day. Eba. What you say? So be a fibroid. A drobby and webby to me and it depends on the size. And no crano says so I drone and you're saying and I'm an free ho crowd. The best thing you can do for your patient is to be able to know the size of fibroid. Be bit me ask as they say fibroid. If you bit me I can say me say fibroid. What I say? It depends on the size, and it depends on baby. I will also make can me check. You say, "Oh, baby, I will do na ya obenya fibroid no." Your submucosal, your intramural, your subserosal, your pedunculated. Enti ni na fibroid too, but ni na approach it different. Ni na so ni worry about as doctors. What I say? But said that wouldn't name moje two. And I say, well. My what dear no uterus no muscle nim na say ma wo moje tu ni pana na say ma ne pin na e ma ne ntimi nyinsa na say ma ne nyinsa bu ma ne nyinsa ne ngina
dear na the fibroid ne ba
the causes on no say me ma catch or say there are several things in medicine we don't know the exact cause, but all we know is that it's an estrogen dependent
estrogen
hormone. Hormone.
She know a descriptive. Over to me as describe.
Sir. No man bia. You produce call body tonkosua ye e ma oba se obenyin sen na frichi kom ha sa no man fertility no masisi so it's one of those hormones what you say but fibroids no so also it depending on it to grow on city no but the exact cause is not really known, but estrogen, because estrogen responsive hormone, I mean benign tumor. I say a tumor chronic trees idea.
Okay. Mr. Asempa, Mr. Asempa say, I didn't know man now more in be no, omo bre ansa no man saying, or say a man now more in be no more bread, almost sign was a no na a woni peduen amo friend hormone, omonya hormone infertility balance or said the imbalance. Why?
Yeah. So all that is classically describes what we call polycystic. The would be a friend of polycystic ovarian syndrome. Okay, you go through now. But who say it can be bad? Polycystic ovarian syndrome.
You go through the
oh me kasi em se me ma na list bi na wo hwe na ha
usu hwe na e cover na ya me de
oh it's okay. I mean, so omo no be a friend of police but what me
yeah
omo no androgen estrogen imbalance dem be se me kanya ne say on so ba bia